Melanoma is a deadly form of skin cancer and rising rapidly in young adults. Dr. Mark Seraly explains how to prevent this killer, as well as how to recognize if you may be at increased risk.
Did you know that 1 American dies of melanoma almost every hour? Pretty sobering statistic, isn't it? Melanoma is the 3rd most common but most deadly form of skin cancer. It may appear suddenly without warning in normal appearing skin, or may develop within a pre-existing mole. So let's first talk about who's at risk. Melanoma can strike anyone, and it can occur in any part of the body, not just sun-exposed areas. Individuals at risk are generally people who have blue or green eyes, blonde or red hair, have more than 50 moles or large moles or atypical looking moles known as dysplastic moles, have a primary family member or blood relative such as a parent, child, sibling, or cousin who has had melanoma, or has had a prior history of other cancers such as skin cancer, breast cancer, and thyroid cancer. The rates of melanoma development in the 15 to 29-year-old females is rising faster than males. It may be related to indoor tanning and tanning salon activities. Dermatologists take melanoma very seriously and routinely recommend to patients to perform their own monthly self-examinations and to consider having an annual skin cancer screening. I can tell you that if you're not getting all of your skin examined, then you're not getting the right skin cancer examination for melanoma. So what should you look for first? Remember any change. New, rapidly growing moles, or a mole that itches, bleeds, changes in size, color, shape, may be an early warning sign of melanoma and really warrant prompt attention. Once a melanoma reaches the thickness of about 1/4, which is only 2 millimeters, it's likely already spread internally. Now here's the good news. Early detection and surgical removal has a 99% cure rate. I've been practicing dermatology for over 20 years. There are 2 key messages that I like for patients to remember when it comes to self-examinations and skin cancer detection. The first key message is any change. Any new or changing lesion should really be regarded as suspect until proven otherwise. The second key message, skin cancer doesn't always have to look like the brochure. So for example, melanomas don't always have to be large, dark, irregularly shaped moles. They can sometimes even be small little pink bumps. Please remember, when it comes to moles and melanoma, any change can be an important change.
That really got my attention. And here with me now is Dr. Mark Seraly to tell me more. Mark, why are we seeing such an increase in melanoma?
Probably there's a number of reasons. We're getting more sun damage. People are spending more time outdoors. There does seem to be also a genetic factor, runs in families. And I think the idea is that people are living longer older. So when you have more people spending greater amounts of time outdoors, therein lies the risk for skin cancer, including melanoma. But the one thing I always like to emphasize to patients is that melanoma doesn't always have to occur on a sun-exposed part of the body. It can even occur where the sun doesn't shine.
Mark, I learned in medical school the ABCDs of looking for melanomas in patients. And can you explain those to the folks out there so that they can hopefully look for things?
Sure. So we use the ABCD and now we've added E. Basically, one should look for a mole that's asymmetric. That's the A, where you can't cut the mole in half and fold it onto itself. We like to look at moles that have a nice even border as opposed to a notched or angulated border. C stands for color. We like to generally see moles that are all one color as opposed to different colors. D, diameter. We like to see moles that are generally less than the size of an eraser head of a pencil. And E is evolution, any change. I've taken my 21 plus years of clinical experience now and really boiled it down into 2 key messages that I like to have people remember. The first message is any change. So if you have anything that's changing, new, or acting differently, you should always regard it as suspicious. And the second key message is that melanoma doesn't always have to look like the brochure, so it doesn't have to follow the A, B, C, D, E. It can be just a little pink bump. So if you remember any change, you'll be in good shape.
Perfect. Great message for everyone. And if you'd like to learn more, visit www.dermatologistoncall.com. Or while you wait, pick up one of the tablets, touch the Dermatologist on Call button, and you can learn more right now.